Welcome to Dr. Amir's official YouTube channel, where complex medical topics are explained in the simplest way, with clarity, visuals, and expert insight. If you're a student, a health professional, or just curious about medical science, you're in the right place. Let's talk about one of the most common congenital heart defects, ventricular septal defect, or simply VSD. VSD is a hole in the wall, the interventricular septum, that separates the heart's two lower chambers, the left and right ventricles. Sound serious? It can be, depending on the size of the hole and the amount of blood that passes through it. Backhand index pointing right small VSDs, often silent, sometimes even go unnoticed, and may close on their own with time. Backhand index pointing right but larger defects? They can let too much blood flow to the lungs, overworking the heart and causing trouble, especially in babies and young children. Let's break down the types. Paramembranous VSD, the most common type, found near the heart valves. Muscular VSD, found in the lower muscular part, may close spontaneously. Inlet and outlet types, rarer, but important in diagnosis and surgery. So what happens in VSD? Stethoscope blood, instead of flowing cleanly to the body, leaks from the high-pressure left ventricle to the low-pressure right ventricle, creating a left-to-right shunt. Over time, this can mean a difficulty in breathing, failure to thrive, repeated chest infections, and, of course, that telltale holosystolic heart murmur, heard at the lower left sternal border. Round pushpin, how do we diagnose it? A clinical exam with a stethoscope gives us the first clue. Then comes echocardiography, the gold standard. Chest X-rays and ECG help assess the heart's workload and lung congestion. Direct hit, and what about treatment? No intervention? That's fine for small, harmless defects. But if the defect is large or causes symptoms, we act. Medical therapy, surgical repair, or device-based closure, depending on the situation. Light bulb, and here's a key point. If not treated in time, a large VSD can lead to irreversible complications like pulmonary hypertension or even Eisenmenger syndrome, where the shunt reverses and oxygen-poor blood flows into the body. So, early diagnosis, regular follow-up, and appropriate management are vital. That's all for today's overview on ventricular septal defect, where a small hole can sometimes lead to big issues, if not taken seriously. Let's take a closer look at the pathophysiology and clinical features of ventricular septal defect, or VSD. Pathophysiology. In a healthy heart, the interventricular septum keeps the oxygen-rich blood in the left ventricle completely separate from the oxygen-poor blood in the right ventricle. But in VSD, there's a hole in the septum. So what happens? Blood flows from the high-pressure left ventricle to the low-pressure right ventricle. This is known as a left-to-right shunt. As a result, too much blood is pushed into the lungs, leading to pulmonary overcirculation, increased work on the left side of the heart, and over time, left ventricular volume overload. If left untreated, this can eventually lead to pulmonary hypertension and even heart failure. Now let's talk about the symptoms you may actually see in a patient. Clinical features. The clinical presentation depends on the size of the defect and the amount of shunting. Small VSDs may be completely asymptomatic, sometimes only picked up because of a soft murmur during a routine checkup. But in moderate to large VSDs, symptoms usually appear early in life, such as rapid breathing or shortness of breath, poor feeding in infants, failure to thrive, meaning the baby isn't gaining weight properly, frequent chest infections, and a holosystolic murmur, best heard at the left lower sternal border. In advanced cases, signs of congestive heart failure may also appear, such as an enlarged liver or sweating during feeds. In summary, a seemingly small hole in the heart can lead to major circulatory disturbances. That's why early detection and regular follow-up are key. Diagnosis and management of ventricular septal defect, VSD. Diagnosis. When a ventricular septal defect is suspected, the first clue often comes from a careful physical examination. A doctor may hear a distinct holosystolic murmur, most prominent at the lower left sternal border, especially in moderate to large defects. But auscultation alone is not enough. To confirm the diagnosis, the gold standard is echocardiography. This non-invasive imaging test clearly shows the size, location, and hemodynamic impact of the defect. Color Doppler can visualize the left-to-right blood flow through the septum. Additional tests may include a chest X-ray, which can reveal cardiomegaly and increased pulmonary vascular markings in large defects, an ECG or electrocardiogram, which may show signs of chamber enlargement or hypertrophy. In complex or borderline cases, cardiac MRI or cardiac catheterization may be used to assess pulmonary pressures and plan for intervention. Management. Management of VSD depends on the size of the defect, the patient's symptoms, and the effect on heart and lung function. Small VSDs, especially muscular types, often close on their own. In these cases, only regular monitoring and follow-up echocardiograms are needed. For moderate to large VSDs causing symptoms such as failure to thrive, recurrent infections, or heart failure, initial medical treatment may include diuretics to reduce fluid overload, ACE inhibitors to decrease cardiac workload, nutritional support in infants with poor weight gain. If there's no improvement or if pulmonary hypertension develops, surgical intervention is recommended. This may involve open heart surgical repair with a patch closure, or in select cases, transcatheter device closure, especially if the anatomy is suitable. After surgery, most children recover well and go on to lead normal, active lives, though periodic follow-up is essential to monitor heart function. Conclusion. A timely and accurate diagnosis, followed by individualized management, is critical in VSD cases. Whether it's observation, medication, or surgery, the goal is the same: to protect the heart, prevent complications, and ensure healthy development. Key points for medical students: Ventricular Septal Defect, VSD. 1. Definition. VSD is a congenital defect characterized by an abnormal opening in the interventricular septum, allowing blood flow between the left and right ventricles. 2. Pathophysiology. Left or right shunting of blood leads to pulmonary overcirculation, left heart volume overload, and potential progression to pulmonary hypertension if untreated. 3. Types of VSD. O paramembranous, most common. O muscular. O inlet. O outlet, supracrystal. 4. Clinical features. O small VSDs, often asymptomatic. O moderate to large VSDs, tachypnea, poor feeding, failure to thrive, recurrent chest infections, and a holosystolic murmur at the left lower sternal border. 5. Diagnosis. O echocardiography, gold standard for diagnosis. O chest X-ray and ECG for supporting evaluation. O cardiac catheterization if needed for pressure studies. 6. Management. O small defects, observation and regular follow-up. O symptomatic or large defects, medical therapy, diuretics, ACE inhibitors, followed by surgical or device closure if necessary. 7. Prognosis. Excellent with early diagnosis and appropriate management. Many small VSDs close spontaneously. Large VSDs require timely intervention to prevent complications. 8. Complications if untreated. O pulmonary hypertension. O Eisenmenger syndrome. O congestive heart failure. O growth and developmental delays. Thank you for joining me in today's session. If you found this explanation helpful, I encourage you to subscribe to the channel, share this video with fellow students, and leave your questions or topics you'd like me to cover in the comments below. Medical education is a journey, and together we can make it clearer, more practical, and more impactful. I'm Professor Dr. Muhammad Amir Memon, and I'll continue bringing you simplified, authentic medical content, backed by clinical insight and teaching experience. Stay connected, stay curious, and above all, keep learning. See you in the next video.